through the week there have been long queues outside the offices of the SA Social Security Agency in the Western Cape. People have been queuing to try and reapply, as I understand, for a disability benefit. Around 200,000 people were told they would no longer receive their benefit unless they applied for it again. The Western Cape Social Development MEC, Shana Fernandez, joins us now. MEC, good afternoon to you. As I understand it, you had a meeting with the National Ministry on this today. Has any solutions been put on the table here?
Good afternoon, Stephen, firstly to you and the viewers, and thank you for the opportunity. Yes, this morning we had met with the CEO of SASSA together with the Cape regional team. The plan that was presented sadly is lacking in certain areas, and one of the outcomes of the meeting was that they would provide my office with a report by the end of day, as well as their 10-point plan. Unfortunately, I think we might have dodged a bullet in that the queues that we have seen, besides posing a COVID-19 very real risk as super spreader events, which I've alerted them to, I am concerned about the dignity and well-being of the beneficiaries. Some of them have actually overnighted, which meant they broke the curfew and in all likelihood would get fined. But more importantly, the fact that most of the beneficiaries are women and children, especially with young babies. So my appeal to SASSA was, I need a smart, detailed plan that talks to how you provide social relief of distress. Because what was concerning is that many beneficiaries who have been given dates extend till as far as June 2021. And clearly that is going to create a knock-on effect because these grants expired in February already. They were then extended to December, and I've just seen a tweet now that says the temporary disability grant has been extended to the end of March. So that in itself then is a victory, Stephen, for the people, the most vulnerable, because these queues would continue. And sadly, many people are left without food to eat or even taxi fare to get them back to their homes where they have traveled from over the last 2 or 3 days. So besides a grant issue, it poses a COVID risk, and it is fast becoming a humanitarian crisis which needs to be addressed.
MEC, there's so many different things to this. Firstly, I think it's just inhumane that we have a situation where people are queuing in the middle of a lockdown, having to break the law, and they're doing it for what is not really a large amount of money to people in the middle classes. That shows their desperation on the one side. The second thing is it would seem to me, at least, that the Social Security Agency is simply not able to process these applications at the moment. And there are lots of reasons for this, but if they aren't able to process the applications, that's why there's a queue. It would seem some other solution is needed. An extension to March probably isn't going to be enough.
Stephen, the Western Cape has the highest number of beneficiaries. We've got, I think on paper, it's 51,570. Let's call it 52,000. Then we have KwaZulu-Natal with 36,827. And I do believe that Pietermaritzburg is facing a similar problem. So what we're going to see is that the grant issue will become like the foster care backlog. It will become a rolling backlog. And my appeal to the CEO of SASSA this morning was, please extend the grant until the 31st of March, and in a very structured, orderly way, ensure that you get these nearly 52,000 beneficiaries assessed. But there is bigger problems, Stephen. In the Western Cape, there are only 9 doctors which SASSA has contracted to deal with this 52,000 temporary disability applications. And then bearing in mind, there are disabled people who need to be reassessed after a 12-month cycle. So it's ongoing. They have alerted me that they are busy with a supply chain process to secure the services of 8 additional doctors. But if you look at, let's even call it 17 doctors across the Western Cape for 52,000 beneficiaries, we are clearly not going to meet that deadline. But my bigger fear, we are in level 3. There is a curfew from 5 a.m. to 9 p.m. People are being criminalized because they are standing in the queue to access a grant. It simply cannot be. Your visuals that you are displaying here talks to the lack of dignity, people's self-esteem, and the fact that we have frail and aged beneficiaries in the midst of all of this. It has the ability to become a super spreader activity, which will set back our health efforts. And at this point in time, health can't afford to be sidetracked because we are focusing all our attention on ensuring that we flatten the curve, especially with the second wave. So there are a couple of issues that need to be addressed. SASSA have indicated that they will provide me with a plan by this evening, and we are also meeting on Friday morning, the 15th at 9 a.m. I have asked that we have agreed together that we shall meet, and they will then provide a plan. So even if the grants have been extended, and I am concerned that Minister Zulu indicated it would cost 1.2 billion to extend the grants up until the end of March, yet we allocate 10.5 billion for chicken or beef in the sky, when we actually have the most vulnerable on the ground who cannot access a grant to feed themselves, their families, and dependent children who also benefit from the care grant, Stephen. So really, to my mind, unacceptable.
We see I have to leave it there. Thank you. The Western Cape Social Development MEC, Shana Fernandez, there this afternoon.